the heart of nursing, caring for ourselves to care for others. Nursing is a calling, a profession rooted in compassion and empathy, but we often forget the most important patient, ourselves. Nurses need self-care to thrive. It's essential, not selfish. Self-care unlocks energy and resilience. Our well-being is linked to those we serve. By caring for ourselves, we make a real difference. The ripple effect: self-care and its impact on patient well-being. The benefits of self-care for nurses extend far beyond our own personal well-being. It creates a ripple effect, positively impacting every aspect of patient care. Studies have shown a direct link between nurse burnout and lower patient satisfaction, increased medical errors, and even higher mortality rates. When nurses experience compassion fatigue or burnout, their ability to provide empathetic and attentive care diminishes. They may struggle to connect with patients on an emotional level, leading to miscommunication, errors in judgment, and ultimately, compromised patient safety. Conversely, when nurses prioritize self-care, they report higher job satisfaction, increased compassion satisfaction, and improved emotional regulation. This translates into better patient interactions, a more positive and supportive care environment, and ultimately, improved patient outcomes. Patients can sense when their nurse is genuinely present, attentive, and emotionally invested in their well-being. This sense of trust and connection is crucial for healing and recovery. By taking care of ourselves, we create a virtuous cycle of well-being that benefits both nurses and patients alike.
An ethical imperative: prioritizing nurse well-being. The nursing profession is built on a strong ethical foundation, centered around the principles of beneficence, non-maleficence, autonomy, and justice. These principles extend beyond our patients to encompass our own well-being as nurses. It is our ethical duty to care for ourselves just as we care for our patients. By prioritizing our own mental, emotional, and physical health, we uphold the principle of non-maleficence, ensuring that we are not causing harm to ourselves through neglect or overwork. Furthermore, by modeling self-care practices, we empower our patients to do the same, promoting their autonomy and encouraging them to take an active role in their own well-being. When nurses prioritize self-care, it becomes ingrained in the culture of the healthcare setting, creating a more supportive and compassionate environment for everyone. Ethical nursing practice requires us to acknowledge the interconnectedness of our well-being with that of our patients. By advocating for our own needs, we are better equipped to advocate for our patients, ensuring they receive the highest quality of care possible.
Nourishing the nurse: practical steps towards self-care. Self-care is not a luxury, it's a necessity. Make conscious choices to nurture your well-being.
Practical steps for nurses. Prioritize sleep, aim for quality rest. Fuel your body, eat nourishing foods. Move your body, incorporate physical activity. Set boundaries, learn to say no, connect with colleagues, foster support, practice mindfulness, manage stress, pursue hobbies, find joy outside work.
Self-care is personal, find what works for you. A healthier tomorrow, the promise of a mentally strong nursing workforce. Investing in the mental health and well-being of our nurses is not just an act of kindness, it's a strategic imperative. A mentally healthy nursing workforce is essential for delivering high-quality, patient-centered care and for creating a sustainable and thriving healthcare system.
When nurses feel supported and valued, they are more likely to stay in their jobs, reducing turnover rates and the associated costs of recruiting and training new staff. Moreover, a mentally healthy nursing workforce is more likely to be engaged, compassionate, and resilient, leading to improved patient outcomes, increased patient satisfaction, and a more positive and supportive work environment for everyone.
By prioritizing the well-being of our nurses, we are investing in the future of healthcare. We are creating a more sustainable and compassionate system that prioritizes the needs of both patients and caregivers alike. Conclusion: a call to action for sustainable compassion. The nursing profession is a beacon of hope, a testament to the enduring power of human compassion. But to sustain this compassion, we must first direct it inwards.
Self-care is not selfish. It's the very foundation upon which we can build a more resilient, compassionate, and effective healthcare system. Let us create a culture where nurses feel empowered to prioritize their well-being, knowing that by doing so, they are not only taking care of themselves, but also enhancing the lives of countless patients they serve.
Together, let us pave the way for a healthier tomorrow, one where both nurses and patients can thrive.